So currently we are here at the Fiah Doe Hospital. His name is Dr. Melvin M. Kabba-Kay. Welcome to Front Page Africa.
Thank you so much, Mr. Franklin Doloku.
They're going to know much about this ongoing surgery that is taking place here at the Fiah Doe Hospital.
Well, we have a team of American urologists that are collaborating with our Liberian urologists, local Liberian doctors, urologists, and over the last 4 days, they have been here at Doe performing surgeries for patients with 2 urologic conditions, men with enlarged prostates and men with urethral strictures. So they have been doing these surgeries over the last 4 days. Today is the 4th day.
So how many patients they have been here to provide treatment for?
So far, we've done 7 prostatectomy, meaning the surgical removal of the prostate. Those men who had severely enlarged prostates that prevented or restricted their urine flow, and we have done 9 urethral strictures repair, or what we call urethroplasty, and currently we have 2 more urethroplasty to go. The surgery is currently ongoing for the urethroplasty. The doctors are currently in surgery as we speak.
So when they entered at this facility,
they came to Doe on February. They arrived in Liberia. The team of urologists from the University of Vanderbilt in the US arrived in Liberia on the 14th of February, and they traveled to Tappita on the 15th of February, and they started the surgical campaign on the 16th, which was Monday of this week. Yes. And so far they've done 7 prostatectomy and 9 urethral strictures repair.
Prior to their arrival, was any awareness carried out that maybe cause people to see patients coming out that yes, we are showing those diseases, or maybe we are showing we have those problems, so they were happy to come out for those treatment?
Yes, of course. So prior to their arrival, we took the last let's say nearly 3 months to create awareness, to get patients to participate in this free surgical campaign. So sometime last year, or around November 8th, I received a call from a doctor in the US, an American urologist called Dr. Frank Glover. He contacted me and informed me that he was going to lead a team of American urologists to Liberia in February of this year, precisely February 16th. And they were going to do surgeries for 5 days, from February 16th to the 20th. So they were going to be specifically focusing on men with enlarged prostates, what we call BPH, and men with urethral strictures. So those are the 2 cases, the two type of patients they said they were going to focus on. So they asked that we should create an awareness, we should try and get patients ready for them, so when they come, everything will just flow effortlessly. So we started immediately. We formed our community engagement committee that went into the communities, that went to far towns and villages, creating the awareness, informing our people that had these conditions to come to Doe for screening, so that when they are qualified, they can be placed on the list and then with these doctors. So we also created radio jingles and sent to the various radio stations, and those jingles have been played on the radio over the last 2.5 months. So all these helped us to get patients. Patients came from very distant places. They came for screening. The screening was done, and those that were qualified, those that had the diagnosis of enlarged prostates and urethral strictures, were placed on the list. They were prepared, and the moment the team arrived from the US, everything was already set and the surgical campaign immediately started.
So how many then you were able to get?
So we were able to get more than 50 patients.
Okay.
But so far, like I said, we've managed to do only 7 prostatectomy, the surgical removal of the prostate, the large prostate, and they've managed to do 9 urethral strictures so far. So currently the doctors are in surgery, the surgical campaign is still ongoing, and before the close of today, they may do additional 2 more urethral strictures.
What become a balance?
We will make an arrangement with them and see how best, like I said, I mean, it is an ongoing partnership, and from time to time we will have these doctors coming to Liberia to let's collaborate with Jackson F. Doe and provide treatment for our people.
What this mean for the hospital?
This is a big boost for the hospital.
Okay.
This is the hospital. I mean, with these efforts, the lives of these people have been will be improved. Their dignities will be restored, because these men have been suffering in silence, in shame, having these conditions. Some of them urine dripping on them, some of them really struggling. But with these life-changing surgeries, Jackson F. Doe is very proud to be helping our people receive these life-changing surgeries. So that is already a big boost for the hospital.
Is this the first surgery free since you took over as the chief medical officer for Jackson Fiah Doe Hospital?
No, we've had 2. Prior to this, we had 2 free surgical campaigns at the eye clinic. So various partners will come. They will do. Just recently, about 2 weeks ago, they operated the eye clinic. They did free surgical. There was a free surgical campaign where they did. They operated on about 112 patients with cataract, with various eye conditions, including cataracts and pterygium. So these patients receive free surgeries from these partners. So this is actually the 3rd time.
But do they have some Liberian doctors they were there?
Yes, currently we have 3 Liberian doctors, Liberian urologists, that are currently collaborating with the team to provide this life-changing surgical treatment to our people.
Some from the hospital here, or they came from outside to join those guys?
They are all from JFK,
Okay,
from the
yes,
John F. Kennedy
JFK.
Medical Center. So Liberia currently has only 3 urologists, and all those 3 urologists are currently here at Jackson F. Doe, collaborating with the team of American urologists to provide this surgical treatment to our patients.
Okay, now, what role Jackson Fiah Doe is playing here when the surgery is going on? Are they providing the materials or those materials from America?
So it's a partnership. Jackson F. Doe has whole role to play. Jackson F. Doe has been involved with a lot of things. It's a partnership. They are doing some, and we are doing our part to make sure that we achieve the best results possible.
How many theaters do you have there, the hospital have?
Jackson F. Doe has 2 functional theaters. So from the inception of the hospital, since the hospital was constructed, there have been only 2 theaters here at the moment, and these 2 theaters have been occupied by the surgeons. But again, we usually try to we are also aware that anytime
emergencies
can come in. For example, if a pregnant woman is in, if a pregnant woman needs an emergency cesarean section, we will quickly find a way to enter one of the theaters so that these emergencies can be responded to.
Okay, any other thing, a closing remark?
Well, I just want to say a big thank you to these doctors from the University of Vanderbilt in the US that have taken upon a time to come and restore the hope and dignity of the Liberian people, our men who have had these urologic conditions and have been suffering in shame and in silence. These are life-changing surgeries that will restore their hope and dignity, and we are very happy. Also want to say a big thank you to the Liberian doctors that have left from JFK to come and collaborate with these American doctors to provide this surgical treatment to the Liberian people in this part of the country. So I want to say thank you to everyone that is involved, the nurses, everyone, because of this campaign. A lot of people had to a lot of people had to work overtime, just to make sure that this is successful. So everyone has been working very, very, very hard, and we just want to say thank you to all of our people for the success of these surgeries.
Thank you, Franklin Dolokwe. Thank you for watching.